Wait.
It is time.
Freshman, they go.
Gentlemen, ready?
The county numbers are still
Frisbee's coming out.
trifle low.
Your dog's escaping.
Service dog Frisbee for those who can't see on camera, but I'm
I
describing.
gotta put
Beautiful poodle.
1,000 stamps on my mailer this
I want to
afternoon.
know where's my position in the
Oh, we got
parade?
one more member coming in here, so
No, I have to find that out.
quick moment.
You said you were going to do it
We
yesterday.
get
I know,
started. Everybody
I got
finds their
busy doing
seats.
my own stuff.
Really?
Yes.
Another service dog. Gremlin graduated and Frisbee's here.
That would be
What?
great.
Fire district president who keeps getting us in trouble, and Mr. Gaffney.
Can I ask you a question?
Yes.
Why don't you straighten that out? You've been with the fire district so long and it's always messed up.
Well, it messed up because they elected an idiot to be there.
All right, you guys ready to get started?
We are
Microphones are
ready.
on, just so everyone is aware.
Get it just in time.
Mr. Strathman, come join us.
Okay. Can I vote too?
Not today.
You can, but it won't count.
Yeah, it won't count. All right, the time being 9:02 a.m. on June 22nd, 2022. I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll.
Silva,
Good morning, Silva is here.
I heard her.
Lewis,
Lewis here.
Jepro,
Shepro is present.
Strathman,
Stefan here.
Tepe,
Tempe here.
Wallace, Purog, Sanchez.
Sanchez here.
You have a quorum.
All right. Can someone ask for unanimous consent to approve the minutes of May 18th?
I request a
2022?
unanimous consent, Mr. Chairman, to
Shepro
approve the
requests.
minutes and place them on file.
Any objections? Hearing none, the minutes are approved. Questions on the, you don't have to do a roll call with unanimous consent.
I know.
Oh, okay.
Yeah, but
It's a nice little trick.
Mr. Sanchez is almost the only one that pays attention to that. But I appreciate it.
Trying to get everybody out of here, you know?
Yes.
Roll call after roll call, just, all right, questions on the finances? No, this month? All right, public comments. We'll take agenda and non-agenda items. Anyone online? I don't see anyone here in person. Okay, we will then go to the executive director section. Ms. Kathy Foster.
Good morning, everyone. Ms. Uche Onwuta will enlighten us with the latest with COVID updates.
Good morning. Good morning. My name is Uche Onwuta. I'm the Director of Health Protection at King County Health Department. And this morning, I changed my title to Communicable Disease Update, just to give you a little situation summary on monkeypox after I've given the COVID-19 report. So thankfully, King County is at medium community level. If you looked at this, you wouldn't have known that sometime earlier, I believe 2 or 3 weeks ago, we were at high community level because our case rate was over 200. Admissions per 100,000 was over 10, and that put us in a high community level. So if we had this meeting last week, we were still at high community level until Thursday when we were downgraded to medium. So we were happy about that. So for today, our cases per 100,000 has come down to under 200. It has been over 200 for some time through this past surge. Our admissions are still over 10 per 100,000. That's where we're medium community level. And the percent staffed inpatient beds for COVID-19 is less than 10%. But you can see from May to June that our admissions are going up. So hopefully, hopefully, I hope next month that it would be on the downtrend because it looks like the surge is ebbing a little bit. Okay. Oh, I'm sorry.
Mr. Shepard, if you have a quick question.
Yeah, the reason why the hospital admissions are up, isn't that because the admissions generally tend to trail the new
Yes.
cases?
Mhm. Yeah. But generally with this surge, even though the admissions went up, the number of deaths are still, let me go back. Okay, so I didn't put in a chart here, but the deaths are not rising as quickly as the admissions are rising. So it goes back to the effectiveness of vaccination. Fewer people are getting seriously ill, so ill that it would ultimately lead to death. Now there are more mild cases, and as the admissions are going up, but the deaths are not going up. Okay. So CDC recommendations, again, is to stay up to date on your vaccines, get tested if you have symptoms. Wear a mask if you have symptoms or if you're exposed to a case or if you're waiting, if you got a positive test. CDC is still recommending wearing a mask in public transportation, and those who are at high risk for severe illness should consider wearing a mask and following other additional precautions, which are the same ones that we've been preaching throughout the pandemic. So what's new this month with COVID-19? CDC no longer requires anyone entering the US to show a negative test or evidence of recovery from COVID-19 before boarding their flight. This is probably welcome news for those who are flying out of the country and coming back, not knowing that the testing is still going on, and then you get to the airport and you have to make, they have those test clinics at the airports. That is no longer required. Also, anyone 6 months and older now may receive COVID-19 vaccination. And CDC also came back with recommendations that people who are 5 years and older may get a booster after completing their primary series. So,
Please. Thank you. Please. Thank you.
okay, so looking at our cases so far, you can see that this is where we were early in late April, early May, and it's trending down right now. Yes.
What about people entering the country, and I'm going to say illegally, came across the border in Mexico or anywhere? Do they vaccinate them?
Do they vaccinate them?
Yeah.
Here in the United States or outside the country?
You mean if they show up and want to be vaccinated?
Why what? If you want to come in the country, if you fly in, you have to be vaccinated. If you fly out, you got to be vaccinated.
So when they're sneaking over
I'm
the
not
border,
trying
we
to-
have a
not
guy
to
there to.
rush. If we really want to stop this, everybody should be vaccinated.
I think everyone can get vaccinated at this point.
Yeah,
So
but I say, if you want to come in here from Mexico or Venezuela, do you have to be vaccinated?
No, we're not requiring,
It's not required at that
not
time.
requiring it.
But they have the option.
Whether they
If they're
come in
listening,
from there
they should
or
get vaccinated.
Cambodia.
Anywhere, but anybody coming from some other country.
We require all illegals to be vaccinated. But we have a little trouble staffing the border to do that. Okay.
You answered the question, which is no. No, here.
This all started with people coming into the US legally
Yeah.
from other countries who were getting off cruise ships or whatever, right? I mean, so.
Okay.
And I think we discussed in previous months that it would appear that we pretty much hit the ceiling of people who are willing to be vaccinated. If they don't now, it's not because they can't find it, it's because they don't want it.
Yeah.
Chaperone Kenyon in that fruitful dialogue.
Go ahead, Uche.
Sorry.
Okay, so looking at the age distribution of the new cases the last 30 days, you can see that, when I show you the vaccination data, you see that the older residents have higher vaccination rates, and there are fewer cases among the older than the younger population. And hopefully, with vaccination, if enough of them get vaccinated, this might change. But generally, it's quite evenly spread. The one thing, sorry, go ahead, Mr. Chair.
Well, let's get through this.
Yeah,
and then
yeah,
we'll come
go
back for
ahead. I
questions.
wanted to ask about the chart, but yeah,
We'll come back.
please finish.
The one thing I forgot to mention with the cases is that, as you know, we have home test kits now. So this doesn't even come anywhere close to a good picture of the number of cases we have in the county, because many people do their home tests, and if they're positive, it's not reported.
Actually, that was,
We'll come back to that.
okay.
Looking at the variants in May, for those that were tested, BA2 had the most number of cases. Of course, these are all Omicron, but we separate them, because those are the variants that are kind of circulating in the area. So we had 12 of the BA2.12. This BA2.12.1, this BA2.12 might be in this, but it's the way that it was documented. And the BA2.3, and then this Omicron was not specified what it was, so I just reported it as is. They didn't specify which of the BAs it was. So we had total number of 85. Again, not all cases are tested for sequence to see whether they're variants or not. So I put in this slide about when to take a self-test. I think I used it at the last meeting as well. Now with fewer cases, it's very important that we test, and that's the reason why the self-test kits were widely distributed. If you find out soon enough that you're positive for COVID-19, you can quickly isolate so that you don't expose everybody else to the virus. So testing when you have COVID-19 symptoms, or when you're exposed to someone, or if you're attending a gathering, you're asked to test immediately before the gathering. If you're positive, you stay home. If you're not, then you can proceed with confidence, even though you could still end up being positive. We are distributing home test kits to King County residents. We've ordered some as soon as they are available. We'll send out a press release, but at that point, people can come to the health department to pick up home test kits if they need them, and we'll distribute them in the community as well. This is from a grant that we received from IDPH. We're also partnering with Shield, Illinois to provide saliva testing at the CaneVax hub. And they're there Mondays 9 to 12, Wednesdays 1 to 4, and Fridays 9 to 12. So looking at the vaccination, King County vaccination, we have about 360,000 vaccinated, and total population, about 68% of us fully vaccinated. This is just a schedule for the vaccination schedule. Now that those who are 6 months and over can vaccinate. We haven't started vaccinating the CaneVax hub, but as soon as we do, this is the schedule. Sorry. I don't want to dwell too much on it, so I can present the slides on monkeypox.
It's hard to read that slide. Can you highlight the dates where the vac center is open?
Oh, it's not on this slide.
Okay.
Laura, do you want to?
It's because I can't read it.
Yeah, this is the vaccination schedule just for your dosages for each of the different
Okay.
shots out there.
Yeah, so was the question for the shield testing, for the testing at the CaneVax
No. He was thinking this was the
Vaccination.
schedule for the
vaccination
vac site.
schedule?
Yeah.
We
It
are-
just, this one just tells you, if you get this, you have to wait so long before you get
Yeah,
whatever comes next.
right. Yeah, it's not connected to the vac site.
For the vaccination schedule for the children, just for your information, we're waiting for the vaccines to arrive. We are in the middle of the summer with very hot heat. We want to make sure they arrive safely and within their temperature range before we post the appointments in the schedule. We are expecting those to arrive this week, and then they will be posted. We're anticipating next week, Wednesday, Thursday, and Friday. We will only do the 6 months to 5-year-olds. In very closed pods, it'll be by appointment only. It will not be by walk-ins because there is some specific training that needs to go on, and this is mixed and dosing is different than all our other vaccines. So we want to take our time to make sure we're giving it correctly and safely to moms. And we anticipate parents are going to have a lot more questions as they come on in with this vaccine. So we want to be prepared for that. So there is some specific training that we have to go through that's being required before we can administer it also. So we anticipate we should be ready by next Wednesday.
Tepe here, let me state that sounds very, very appropriate. And I'm really glad that you're taking that level of caution. One of the questions I had was that at least one of these vaccines now require 3 doses for the children.
That's correct. The
No.
Pfizer will be a 3-dose series. The Moderna, which was approved for 6 months all the way on up and older. So the Moderna, as you may recall, was only for 18 years and older up until last week. The new dosing and the new combination of the formula will be for 6 months and to 6 years of age, then 6 to 11, and then 12 and on up for adults. So all ages will be covered by Moderna. We will have both vaccines. Many of our healthcare providers in the county are only carrying the Pfizer, but we will be carrying both Moderna and the Pfizer.
Yeah, well, and again, my concern is misinformation and lack of information. So if you've got a way to be able to publicize in particular what you're going to do and how you're going to do it, and if we can be of any assistance in doing that, I'd love to help. So thanks for doing that.
Mr. Shepro.
Yes, is there any reliable data yet on the number or type of adverse reactions to any of the vaccines at any level. You know, you hear alleged anecdotal evidence, and even the true anecdotal evidence is still anecdotal evidence. I just wondered if there's anything telling us what's going on there.
Yes, when they come out with the emergency use authorization, there's the fact sheet that you give to recipients. And that's usually a very abbreviated, maybe 6 to 7 pages. The one that go to the healthcare providers is around 36 to anywhere to 58 pages. And that does carry all the statistics for all the studies that was done, all the side effects that came through. And so that's what we're researching right now, because those just became public now for us to go through. So all the research studies are listed in here with side effects, how often it was seen, and compared it to placebos versus the vaccine. So I'm more than happy to share those with you. They are online. They're available to anyone to get if they need them, but I can certainly send those on out if you need those.
What is that document called?
It's called Fact Sheet for Healthcare Providers Administering. So you would look at the healthcare providers versus the fact sheet that you give to recipients. So when you come in, we're mandated to give the recipient one. But this is what we study to use to understand and answer those questions as people come in wanting to know what's the most common side effect, what kind of things should I be watching for, when is it important for me to touch my doctor or take them to the emergency room versus something I can manage at home. So those are the questions we go through and find out that information so we can share that
And
with
who
those.
publishes that?
It comes from the manufacturers, so Pfizer and from Moderna. It's their studies that they sent to FDA and CDC and ACIP.
I
Mr.
just
Shepherd.
wanted-
Sounds facetious, but it's not intended to be. Is that kind of the equivalent of the little postage stamp thing you get in your medication that unfolds to the size of a bed sheet and says everything that every study ever said, you know, could cause high blood pressure, could cause low blood pressure, could do this, could do that, which probably satisfies some lawyer's disclosure requirement, but often is more confusing than
Understandable.
enlightening, right?
Well, it's not written for the general public. It's technical. I've seen the document that you're talking about, so I just wanted the name of it out there. But
I just wanted to add that there's also a reporting system for, you know, every single situation where, you know, there's any adverse reaction.
Right.
And, you know, CDC keeps a record of that. That database is called VAERS, VAERS.
Yeah, I mean, I guess that goes to my point is that if you've given, you know, 3 million doses, it might not be surprising that you could fill up 58 pages with someone that said, my arm hurt, or I had a fever, or whatever.
yeah, it's not causative. There's no
Or
proof that there's
statistically
causative. It's
significant.
just, you know, somebody got some other illness happened after getting the shot, but it doesn't mean the shot caused the illness or the condition. So that's what the VAERS system is. It's not accurate in that sense. They have to prove that data. So
When it's appropriate, I have a question about one of the earlier slides.
okay, let's get through this. 'Cause
I wasn't sure.
we're already almost at the halfway mark. So we
Oh.
got another meeting after us.
Okay, so I think many of you have heard in the news about monkeypox. We do have an outbreak going on right now globally and in the United States about monkeypox. So I wanted to give you a little bit of information about what monkeypox is. It's caused by a virus, the monkeypox virus, which is an orthopox virus similar to smallpox and cowpox. It's not new. It's been around since 1958. First case was in 1970 in Congo. It's prevalent in East and Central African countries. And the one known to carry the virus, African rodents and monkeys. The incubation period is about 4 to 17 days. The good thing about, if there's anything good about monkeypox, is unlike COVID, people are not contagious during their incubation period. It's self-limiting. Most people fully recover. The mortality is 1 to 10%, even though with this particular outbreak, we haven't seen any mortality. So the spread has been recently in Europe and the USA, and we've seen it mostly among men who have sex with men, but anyone can get infected. And with other outbreaks, it was not in this community. So it also responds to a smallpox vaccine. So far in the USA, 113 cases, in Illinois, 15. Globally, just for this outbreak, we've had over 3,000 cases. So these are just pictures of the monkeypox disease. The symptoms are usually fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, rashes or sores, various stages of it. It's really difficult, because there are several stages and you wouldn't know which the person is at. So always seek care if you see any unusual rash. Transmission is by respiratory droplets from skin lesions and from body fluids and from contaminated objects. It can be transmitted through airborne transmission, but that's not the predominant mode of transmission. So monkeypox can be spread from the time symptoms start until all sores have cleared and a fresh layer of skin has formed. And this can take several weeks. So testing is critical. Getting tested and quickly identifying, isolating the case and doing contact tracing, monitoring those who are contacts and isolating them if they become a case. That is the bane of the epidemiology existence. And that is how we address most infectious diseases. So monkeypox responds to the 2 vaccines up there. And also, right now, IDPH is recommending vaccinating people who are in clinical and lab research personnel and certain healthcare and public health personnel, but not everyone. We do have antiviral therapies for monkeypox. So what should a person do if they have a new or unexplained rash, sores, or other symptoms? We're asking people to avoid sex or being intimate with anyone until you have you've been checked out by a healthcare provider. If you don't have a provider, visit the public health clinic near you. In Kane County, there would be the federally qualified health centers. If you see a healthcare provider, remind the healthcare provider that monkeypox is in circulation so that they can, if they suspect monkeypox, to get you tested. And think about the people who you've been close and personal or have sexual contact with in the past 21 days. And you might be asked to share this information if you have received a monkeypox diagnosis to help stop the spread. Uh-oh, not sure what I did. That was the last.
Oh, there it is.
one. Any questions?
Mr. Shepro?
Yeah, could we go back to the slide that had the hospitalization and new cases? Was near the beginning, I think.
Probably the third one.
Blair, are you running this? Oh, is the clicker working?
Oh, I'm sorry.
Oh, it's okay.
So, yeah, I think it was the, yes. So the 5.3% inpatient beds, my question is, what is the underlying number? In other words, how many beds is that, or patients does that translate to approximately?
I can get that for you. I don't have it here. But I can get that for you. It's available.
I mean, I'm just, 5.3% of 100 is.
Of all
obviously-
admissions, yeah. Of all inpatient beds.
I was interested in that. And
The number.
on the one where you had the I think it was the colored graph.
The ages by age,
About age, yeah.
cases by age, yeah.
I guess you actually started to allude to this. So I guess the question is the data getting less reliable either because people aren't as sick as they used to be, so they don't bother to tell anybody? And then you mentioned also the prevalency of home testing and so forth.
Mhm.
You have any idea what, other than we know that we're not getting that, how is that affecting your view of the reliability of the data that we do have?
So for the cases that we know, this is the age distribution. Definitely the cases, COVID cases are underreported because the self-reported cases, the self-test kits are not reported. So I forgot what your question was.
Well, all
You're
right.
thinking, you're wondering whether the data is reliable. It's as reliable as the information that we get in. So the information we have now is based on those who did PCR testing.
Maybe my question is this, and it probably doesn't have an answer. Is there any estimates, either locally or nationally, on the number of cases that are estimated or believed to be unreported? And I
Yeah.
think the answer is probably nobody has any way to know what that number would be.
So there was a study that CDC did that came out in MMWR, I think it was last week or the week before, about results from self-test kits, but that's just a one-time study. Yeah.
Ultimately, we don't know.
Is there any public benefit to trying to encourage people to report under circumstances where we won't know unless they call it in themselves? Or is
Well,
there-
I think the way CDC addressed it was this. We tried to get data to help to inform our decision. So now we're in the, at this time during the pandemic, we're asking people to, to do the right thing, to isolate if you're sick, to get tested, if you're sick or if you're exposed. So it's not that the data is not important, but the data is used to address the issue. So it's just another way of looking at it. We're so focused on data, but it's not a means to an end.
Presumably, the hospitalization data is highly accurate as
Right.
opposed to how many people are getting it.
Exactly. Those who are seriously sick are
Thank
the
you.
ones that we're concentrating on.
Any other questions? Okay,
Thank you.
thank you, Jay. Who's next? We got the statistics report.
The executive director was still reporting.
Yes. Okay, so the next item, the King County Health Department May statistics report. That was attached to the agenda packet, so we'll take if there's any questions on that. There isn't a presentation, but it was attached, and if there's any questions.
I had a question about the Campylobacteriosis, but I'll save that for after the meeting.
Okay.
Just kidding. There's so many diseases on there you've never heard of.
I know. All right. So, and then the next agenda item, so our quarterly strategic plan summary. So this is Q2. It was also attached. So if there are any questions, I also have Claudia Reginato on. I believe she's on too. If there's any questions, she can answer that as well. She's our data and quality coordinator.
Does anyone have any questions on the quarterly strategic plan summary? No? Okay. We do have a resolution. If I could get a motion in a second to discuss and potentially pass authorization to enter into grant agreements.
Happy moves.
Tepe moves. Can I get a second by anybody? Strathman seconds. This is just giving Madam Chair the authority to enter into multiple different contracts, allowing us to accept the maximum amount of money possible. I think there's somewhere in the ballpark of about 28 different grants. Blair, if you could scroll down a little bit, there is a chart that shows. Yeah, so this table, if you keep going, Blair, just to give them a
Whole list of them.
at the bottom, there's a list past this table. So there's about 28 different grants. Yeah, there you go. And this just gives Madam Chair the authority to sign into them without having to come back to the committee each time one of these comes up, asking for the maximum amount. Any questions on this one?
Was this reviewed by the state's attorney's office?
I would have to ask Kathy. I would assume everything has been reviewed.
I have
by
a
the state's
question
attorney's
about it,
office.
but I'll talk to you offline.
Okay. Did you have something, Ujay?
And I'm saying that it is reviewed, vetted by the
It was.
state's attorney's office before, you mean the individual grants, right?
This resolution.
Oh, I'm sorry.
Correct. And this is, we've had these before, it's called the umbrella grant.
The umbrella,
Because
yeah.
there's, all these are routine
Mhm.
that we provide these services.
Yeah, I forgot that term, the umbrella resolution. Any other questions? Seeing and hearing none, clerk, please call the roll.
Lewis. Jepro,
Present.
Lewis, yes. Sorry, I was
Thank
muted.
Strathman,
Strathman, yes.
Pepe,
Happy yes.
Wallace, Silva,
Silva, yes.
Sanchez.
Sanchez, yes.
Pass.
Okay, next we have animal control.
Good morning, everyone. I apologize. I was hoping to be there for Kathy's final meeting, but I had a personal matter I had to attend to today with my family. All reports are on file. If anybody has questions, please let me know. I just wanted to run through some vaccine clinic stats real quick. We're about halfway through. We're in our little midsummer gap before we start up again in August. We do have our final 3 of the year, August 27th. It'll be a Saturday, September 21st, a Wednesday, and October 1st. To date, we've already seen 191 dogs vaccinated for rabies. 61 of those were seniors. 51 cats were vaccinated for rabies, with 30 of those being seniors and 50 microchips already. We have a lot of repeat visitors that are so happy with what we're doing. They love the way the pace is going. They think we get better every single year. And these are such amazing comments to hear from people, because we really do try to do better every year. And again, also increase our pace, because some of the wait times are about 2 hours. But if anybody has questions, I'm always available. If you want to tour the building, I would love to give tours. Please let me know. I'm always here for you.
Any questions for animal control? Mr. Shepro.
Yeah, good morning.
Good morning.
This came up the other day. What is our policy as far as rabies control with respect to recovering or testing a dead animal that somebody thinks might have rabies? My impression was from years ago is that we didn't do that. We didn't, if somebody found a raccoon, you wouldn't test it for rabies.
You are correct. At this moment, the only thing the state wants from us is we're doing surveillance of skunk. Skunk rabies has not been seen in Illinois, but it is something they are still testing for. So we only do animals that are submitted to us as sick and injured. We don't pick up deceased animals from the public to have them tested. If people would like to have them tested, though, they're more than welcome to have them sent to the University of Illinois Pathology Lab at their own expense. And the University of Illinois would be more than happy to test that for them.
Thank you.
Of course.
Any other questions? Mr. Brown?
Yeah, thank you, Mr. Chair. Brown speaking here. Brett, could you explain if a resident within a city limits is concerned about the coyotes that are running through their backyards, what involvement does the King County Animal Control have, or what are they supposed to do?
The county itself does not have any involvement in that. What we do is we direct people to the Department of Natural Resources. They're the ones who currently oversee the coyotes. There's also a gentleman, if you go to our website under coyotes, his name is Mark. I apologize, I don't have his last name in front of me, but his phone number is right there. You can also contact him. He actually does the tracking of coyotes for the Department of Natural Resources here in Illinois. He's an amazing resource. He's out of St. Charles, Illinois. We refer a lot of people to him, and he's great at answering everyone's questions and explaining to them what can and can't be done from the Illinois side.
Great, thank you.
Of course.
Okay, any other questions? All right, Brett, thanks for being here today. And as I said earlier, best wishes to you and your family.
Thank you.
You guys will get through this. So, all right. All right, nothing else for animal control. We have nothing for old business. Can I have a, unanimous consent to place reports on file. Mr. Shepro asks, no objection.
Reports on file.
We have no need for executive session under new business. I don't know if it's new business, but today is Kathy's last meeting with us as the interim executive director, but we'll just call you the executive director because you've been holding it down for a year and a half.
This is my last and 19th meeting, Public Health Committee meeting.
19th.
So,
So I just wanted to give mention of that and say thank you for all the work that you put in. I know when you took over as interim executive director, weren't expecting it to be for such a long duration. We definitely were happy that you helped keep everything together as we got through some of the hardest parts of COVID, and just all the things you've gone through on your own personally and brought to the table only a smile and just calm strength and determination. And I just wanted to thank you for being here with us all this time. And your retirement, I'm sure you're looking real forward to that and you're going to enjoy it, but we're going to miss you here. So I just want a round of applause for Kathy.
Con Dios.
What's that? Vaya con Dios. Vaya con todos, as one of my friends used to say. So yes, thank you. And I didn't have a slide presentation put together. Now I'm thinking I should have, but in any case, we wish you well. And we think we're going to be in good hands with the new director coming in. I hear he's all right. So we'll see how that goes. Looking forward to it and seeing what kind of changes we make and what we do in the
Probably
next.
the last meeting at which Mr. Isaacson will not have said anything.
Right. Don't say anything. Keep it that way. Don't jinx it. All right. So unless there's anything else that anyone would like
Yes,
to add, Mr. Tempe.
in honor of Mr. Kenyon, I'd like to move to adjourn.
We have a motion to adjourn on the
I
floor.
will second.
A second by Mr. Shepro. All those in favor say aye.
Aye.
Aye.